Okay, it's 4 p.m. in Singapore, so let's get started. And good afternoon, and well, good morning and good evening to some of you. I'm Amina Mahmood. I'm the Deputy Director of the Sing Health Duke-NUS Global Health Institute. We are based in Singapore, and today we are gathered to kind of talk about adolescent health and well-being and kind of look at the different factors that impact this very crucial demographic. Before I want to go into the details of the webinar, I do want to say a warm welcome to everyone in the audience. And it's great to see this large group in attendance from across the region. I'm very pleased to open this first webinar, this 4-part webinar series that we are co-organizing with the United Nations Population Fund in Lao PDR. As you might know, UNFPA, or United Nations Population Fund, is the United Nations agency that focuses on sexual and reproductive health, and their mission is to deliver a world where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. And we couldn't have found a better collaborator to co-organize this series with. For me personally, it's always an added bonus to work with UNFPA because I used to work with them previously in New York, in Bangladesh, and Ethiopia. So I'm delighted to kind of reconnect with the UNFPA family. We connected with them, with the UNFPA Lao office on another webinar. And so when we had this opportunity to work closely on this one, we are really delighted. A few words about why we're discussing this topic. We really felt the need to focus on adolescents as they're often overlooked in health discussions. We kind of fall in between the focus on infants and children and then, of course, adults. And this is despite the fact that this is a very crucial period of transition from childhood to adulthood. It is a time that people are forming their identities, they're establishing life patterns, they're exploring their sexualities, they're just learning about themselves. So we really felt that this is a very a demographic that we really want to kind of talk about and see what are the challenges that their health and their well-being face. It could be psychological, it could be social, it could be developmental, sexual, educational, there's so many of them. And of course, COVID-19 hasn't made any of these any easier. So we really hope that this series will bring to light some of these important issues. Now about the first webinar, we're starting with an umbrella overlook of what the impact of COVID-19 on adolescents was. We'll be looking at case studies from both Lao PDR and Malaysia, and I'll be the moderator for this first webinar and the discussion that goes on. But before I introduce today's speakers, I want to turn over to Mariam Khan, who is the UNFPA country rep in Laos. And it's been a pleasure working with and a very easy partnership with Mariam and her team on this webinar series. So I'll invite you to say a few words and then we'll turn to the speakers. Mariam, over to you.
Thank you. Good afternoon, everyone. I'm so delighted, just like Amina, to be hosting and co-hosting this series of regional webinars, and especially pleased that over the set of the next 4 webinars, we will have the chance to share some of the outstanding work that is going on in Lao PDR on the topic of adolescent health. The collaboration with Singapore Duke University is a new one for us. And I would very much agree, Anna, it's been easy and smooth. And I think that's because of the common understanding that we have on the relevance of the adolescent health agenda for the region, the demographic, and for the country, Lao PDR, of course. But more importantly, for the connection between the academic part of the work to the applied service delivery part of the world, and how important it is that that cycle of information between programs that serve young people on the ground keep in touch with research, evaluation, monitoring to strengthen the academic know-how. And that's why we hope through these webinars to expose ourselves, our partners, but also share some of the experiences that are very positive. 2 things that I would like to highlight. A couple of days ago, the UNFPA Global Report on State of the World Population was launched. And for the first time ever, it made an attempt to measure laws, policies, regulations, and strategies that exist in countries for bodily autonomy. Bodily autonomy is a person's right to choose and make decisions about their own bodies, if, when, and how many children to have, to engage in a relationship or not, so many other dimensions. This is indicator 5.62 of the Sustainable Development Goals, and Laos scores 96 out of 100 for this particular indicator, only in terms of the existence of frameworks. Implementing them, of course, is where we are now, collectively with other countries, trying to make this journey, which is a new one, because adolescent health does not traditionally receive, neither in this region or elsewhere, as much attention as other areas of the demographic within population. So I'm excited to be hearing from some of the speakers today, and very pleased with this partnership. And I look forward to engaging with people across the region in this exciting area of work. Thank you, Amina.
Thanks, Mariam. And yes, we certainly hope that this leads to many other things. So I'll start with our first speaker, a quick introduction. So our first speaker is Dr. Sitthiroth Rasphone. Dr. Sitthiroth is Acting Director General of the Center for Development Policy Research at the Ministry of Planning and Investment in Lao PDR. The Center for Development Policy Research is staffed by the Ministry to research and formulate policies, strategies, frameworks, mechanisms, and measures related to socioeconomic development at the national and provincial levels. So this is a really big and important portfolio. Dr. Sitthiroth holds a PhD degree in development economics from the Australian National University, and his research interests include macroeconomic policy, looking at poverty policies, educational policies, nutritional, and poverty. So with that very short introduction, I will ask him to take over and present his slides.
Thank you, Amina. Hope everyone hear me now, right? Good afternoon from Vientiane, Laos. It's a great pleasure for me to attend today's webinar on the impacts of COVID on adolescents. So I would like to thank SDGHI and UNFPA Lao office to invite me to be the speaker in this important webinar. So let me share the screen. I hope you see on my screen here. Everyone see the screen, right? Okay. Yes. Okay. So today I would like to give a presentation on the impacts of COVID-19 on the adolescents in Lao PDR. This is based on the study findings of the rapid assessment of social economics impacts of COVID-19 on children, adolescents, their family in Lao PDR, which is conducted in the middle of last year, supported by UNICEF, UNFPA, and also my ministry MPI. Let's start. It is estimated that the population of Lao PDR will increase from 7.1 million in 2020 to reach about 8.1 million in 2013. That's an additional 1 million people. It's in just 10 years time, next coming 10 years. So if you look at the pyramids, you can see it here, population pyramid, you can see that the changing age structure in Lao PDR between 2015 to 2013, it indicated that Lao could experience the demographics dividends of this population transition. So it means that the large side of the young people would enter into the workforce in coming decades. So it's expected that the population in working age will increase about 1.4 million, or increase from 64% in 2020 to 69% of population in the next 10 years. So that's therefore, it's very important for Laos, the government of Laos need to pay more attention and invest more in adolescents now, since we need to invest more in our human capital for our quality of growth and for our further developments. So look at the, before I'm going to the impacts, I would like to give you a little bit of current situation of adolescent and the young people in Lao PDR. So there's about 1.4 million adolescents at the moment, which is about half of them are girls. So adolescent and the young girl in Laos, it's particularly vulnerable groups of people, especially those who with the ethnic minority background, living in the rural area. So that's why, although in the past years, there's a big progress in terms of promoting developing of the adolescent in Laos. But anyway, many challenges need to be addressed. You can see, I can show some key indicator of the adolescents development. This is all the indicator that we already set up in the Nang Noi development programs for adolescents. So we try to sort of reduce this indicator. You can see that about 43%, almost 43% of adolescent girls between 15 to 19 are linear. So 83 birth per 1,000 girls age 15 to 19 years. This is quite high in Southeast Asian region. Of course, nearly half of these girls are out of the school. 23% of them are currently married, and 42% are in the child labor situation. Only 10% boy and girl, age 5 to 17 are only covered by any health insurance, which is very, very low. So that's sort of situation of the adolescents and the young people in Laos. So let's go for the impact. So from our study undertake with our international consultant, we look at the impacts of adolescent COVID on adolescent in 4 dimensions. One, it's impact, economic impacts. Second, education, health, and protection. So, of course, with the economics downturn, first one, economic impact. With the economics downturn, we could see that if the result, the household income loss, and also affect to the people livelihoods, especially a tourist sector, which is quite important sector in our GDP. It's also severely affected by the pandemic crisis. It should note that this sector, tourism itself, contribute about 11% of total employment. It's about 22% of employment in the urban area. So it's tourists also create more job in the tourist-related sector. So, however, the employment in this sector, it's mainly informal, very unprotected and seasonal. So that's why the impacts of the pandemics, it's greater for women, of course, since about 62% of employment in this sector involved with tourist-related sector. Also, since the commodity price expect to weigh down the price consumption, the consumption, private consumption, consumer confidence, and also moderating the household wholesale and retailing. The next one I like to mention about migrant remittance, which is very important for Lao case. You can say about around 300,000 to 400,000 Lao workers, or about 15% of the Lao labor force, are working across the border in Thailand. So these people now they at the moment they are losing their job in our neighbor. They are not able to make the remittance at home as it used to be. So that's why many of them at the moment decide to come back home. And that's why it's increased the risk of unemployment in Laos, and also it's affect the household income. So then, of course, I mean, it directly affect to the adolescent. Also, with the COVID impacts, the government also suffer the budget deficit. This is the budget deficit even increased higher from early years. We expect around 7 to 8%. So as the result, the government had to cut down the physical expenditure, especially the social expenditure such as social protection, public health, education. That also affects the adolescent. That's for economics. Let me move to the impacts on the adolescent education. So based on our micro simulation, it indicates that secondary school level attendance rate expected to drop by 5% point nationally. So it's more likely that it's a further increase after second lockdown. Since April this year, Laos now facing with the second round of the outbreak of the pandemics until now, and this round its impact it's much larger because it's spread into many provinces of the country compared to the first round last year, which is only we have the lockdown policy of just only 1 month. So of course, the lockdown situation here, it's also the figure can tell you in our study show that if you compare between baseline and the COVID situation, so the uptake of secondary education correlated with the wealth index, and the lower income households are less likely to have children attend secondary school, especially in the household where the adult literacy and the digital connectivity is low, which is especially case in the rural area. As the risk of the children dropping out from school, it's increasing sustainable. Not just only the dropout, but in terms even you attend the distant or TV learning, in terms of quality of education also affected. The next it's impacts on health, adolescent health. So the data here from Ministry of Health, I'm sure that since 2000 we can see the drop, first drop of the contraceptive coverage since 2015, about 2%, and also there's a increase in the abortion according to the data report from Ministry of, especially during the lockdown, because of the all the young girl, the adolescents cannot go to access. They cannot access to the service during the lockdown time, and also that's why it's also we see some evidence increase of unplanned pregnancy, especially among 15 to 24. Of course, the challenge to access to sexual and reproductive health service at the local community is very difficult. So the impact of COVID also affects on the mental health. According to the number from information from Lao Women Unions Counseling Center or the Lao Youth Center Counseling Center, they will report that there's an increase, the calling to consult about the emotional impacts, anxiety, psychosocial stress, especially for young people, adolescent. So that means that if situation still continues, more and more, there's a more case that need the support, from in terms of the mental health. So next, the impacts on the protection. This is similar things. There's increased report case on during the lockdown because the household family, the income, household income loss, people lost their job. And that's why there's increased the research of adolescent girl and young people exposed to gender bias violence, all the harmful practice such as the early marriage, all kind of exploitation, abuse. And then also I just mentioned about school closed down. It's also and the interrupted health service. Those kind of things, it's also create the stress and lead to the adult pregnancy and child labor tend to increase. So I think that's the impact that we find out from our study last year. So what's the policy that we try to look at this and try to promote allow? So I think first, when we decide COVID response measure, I think it should really look at the problem based on the sensitive and inclusive to the need of all adolescents and the young people, those who are the most vulnerable groups. For example, like adolescent girl with disability, and also we need to also invest more in the policy, the measure that really focus on adolescent and young, especially specific for the adolescent girl. And also we need to increase the support for the young people, adolescents, in terms of the providing the risk communication on the COVID, through the community-based the information education, IEC, social media, online, offline, with the active participation of the adolescent, especially adolescent girl. And there's a need for collecting some data, doing analysis, try to work with the disaggregate data, to work out who's the most impact on that. And then we can do the monitoring system to follow up on the indicator. And also the need to get engaged with those adolescent, young girl in the process of planning for the program, implementing the monitoring. So for specifically for health, I think there's a need to continue providing of the the information and the service on the sexual and the reproductive health. The men also providing the the support in terms of mental health, psychosocial to adolescents, telephone hotline, consulate nationwide, because at the moment the coverage now is just mainly based in the main city, So we need to expand that also to make sure that they can access to a safe water, hygiene, food, sanitation facility, especially for all adolescent girls, and also continue to access to those the nutrition, food, and also the service, nutrition service. For education, of course, I think there's a need to provide online education further, especially in the rural area, where the parent, they cannot make effort, or even the technology is not available there. Also, there's a need for provide the financial assistance support, especially the family that have affected by the income loss, they lost their job. The continue of the comprehensive sexuality education to adolescent, to school online, offline, mobile application. There's a need to training a teacher, educator. This is very important, especially in the rural area. Although we provide distance learning, but then the teacher are not able to manage, and all the technology and how to manage the class, with virtual class. There's protection. I think there's a there's need to strengthen the protection, gender bias, violence prevention, response service, address online harassment, improve intersectoral coordination is very important, and reference pathway, for gender-based violence, engage in the health, social, police, all kind of sector together, justice sector, engage both boy and young men, to share responsibility in their family, and also provide a gender-responsive social protection intervention and service to reduce the risk of child marriage. And also for the social and economics, need to provide a kind of short-term cash transfer program, to support the family that who are affected from the impact in terms, especially from economics. There's a need to increase the training, skill training for those who lost in the job, to reallocate those young people into the new area that there's some demand for the labor to increase employment, and also to broaden the national safety net. You can see only 10% now, it's very small. And also there's the need for strengthen the regulation, the legal frame, like labor law and social protection law and others. I think that's the end of my short presentation. Thank you very much. Okay.
Thank you so much, Dr. Sitthiroth. That was a lot of information you shared with us. So it'll take some digesting, and I hope we have a chance to discuss some of these issues, all together. But certainly, at this point, the two things that really struck out in my mind was, the multidisciplinary, multidimensional aspects of these issues. So it's health and education and economic impact can't be really separated from each other. So it's really also important to think of how to tackle these at that multi-sectoral, multi-dimensional view. And then the other point that is always there, the poorest sections of population are the ones always impacted the most. I mean, it's kind of seems almost an obvious thing to say, but I think it needs that emphasis and reiteration and kind of retelling it, because we need to think of how to best address that. It's the poorest sections, and then usually the females who are impacted the most. So keeping those in mind, I'll now introduce our second speaker, which is Ms. Jayamalar Samuel. With a total of 16 years of professional experience in the social development sector at the national and regional level, Jaya currently holds the position of Assistant Representative of UNFPA Malaysia. Jaya plays a leading role in strengthening Malaysia's capacity to implement the ICT Program of Action for the achievement of the Sustainable Development Goals. She is responsible for ensuring the integration of population issues, sexual and reproductive health, and gender considerations into the broader national development agenda. Her professional expertise includes 8 years of work on sexual reproductive health and rights, while attached to the International Planned Parenthood Federation in East and Southeast Asia and Oceania. And previously, she had worked in grassroots experience advocating against violence against women and children. She was based with the Women's Center for Change. She also has previous experience working in the private sector when she led community sustainable projects with national partners across Asia and Africa, which included Maharani, the flagship program for girls' empowerment. Jaya holds a master's degree in communication from the University of Science in Malaysia, and we look forward to hearing, all these multidimensional aspects of her work come together in her presentation. Jaya, over to you.
Thank you so much, Amina, and thank you for organizing this event and giving us the opportunity. You can see my presentation is from the Malaysia perspective, whereby we did a study with UNICEF and UNFPA on the social economic impact of COVID on women and children in the urban poor area of Kuala Lumpur. So the photos you will see throughout the study is all taken by the adolescents and young people. Can I go to the next slide, please? Okay, in Malaysia, we do have a national adolescent health policy, which was launched in 2001, and it comes together with the National Adolescent Health Plan of Action, from 2006 onwards, and the revision was made in 2013. So we have current National Plan of Action is 2015 to 2020. Adolescent health services, all government clinics do provide adolescent health services according to the policies. And in Malaysia, currently, our adolescent population is around 5 million. So around 16% of Malaysian population is adolescent. Next slide, please. So the COVID situation in Malaysia is, I just thought it was good to give an overview before going towards the study. Currently Malaysia is going through a second wave of COVID. Like for example, yesterday we had a case of around 11,000 total cases of COVID yesterday, and currently I think total number of cases in Malaysia is around more than 800,000. And the response, the government has providing various economic stimulus package to weather the impact of COVID. We are currently on a second lockdown, which is also movement control order, and whereby the sub-district of Selangor and certain part of Kuala Lumpur are in a total lockdown. And we are also, the government has rolled out the national immunization program. And I think since as of yesterday, I think around 18 million people have registered, and around 7 million people have already gone through their first dose. For the young adolescents, although it's been approved by Pfizer for vaccination for use in adolescents, but more studies and more consultation has to take place before this rollout takes place. Next slide, please. Okay, here is on the COVID impact on the urban poor. Before I go to the study that we done with UNICEF and UNFPA, I also just wanted to highlight a study that was done locally by the Kazana Research, where it also shows that those people who are staying in PPR flats, or PPR households, or we call it as PPR flats, are low-cost flats or in urban places where it has very limited space inside and also outside of the flats compound area. So they do not have flexibility. Most of the people are staying in PPR flats do not have the flexibility to work from home due to the nature of their job. So in that sense, sometimes they even lose their only source of income. And also because of various lockdown and restrictions and control to prevent the spread of COVID, this also leads to their access to affordable goods are limited, and they also have limited access to public transportation. And the poor living condition of these households is also very high density area and is open for risk of virus transmission, as well as a detrimental effect on the physical and mental health. Recently, we just found out somewhere neighborhood near my housing area where the whole PPR flats area has been completely locked down for tracing and testing of COVID, and those who are not infected are being given vaccinations. So it's a mass vaccination is taking place. Next slide, please. Okay, on the family of the age study that I'm going to discuss from this slide onwards. This study was done with UNFPA and UNICEF in Malaysia, which we started last year. And the first phase of the study started in May, where the first lockdown started in Malaysia, which is on March 18, 2020. So the study was conducted to support the government of Malaysia to mitigate direct and indirect impact of COVID on vulnerable groups, and it specifically focused on women and children. And it's conducted in 500 families residing in PPR flat, which is a low-cost flats in Kuala Lumpur. And the data collections for a period of 9 months. And it has 3 methods of quantitative and qualitative method. It's a socioeconomic study, well-being interview, and photograph. As I mentioned earlier, the photographs that you will see throughout the presentations are taken by the young people, because they were also given an opportunity to get involved in the study. Although the study did not directly talk to the adolescent, but whatever I'm going to share with you, when it's an impact on the head of the household and coming from a poor background and also having loss of income, there are a lot of implications that also impact the adolescent. So this study was done in 4 phases. And the data collection was on the phase 1, phase 2, and the phase 4. Phase 4 was just happened beginning of this year. And there was also interviews done with experts and also with NGOs on the third phase, which is the beginning of this year. Next slide, please. I also like to see all the findings, every phase of the finding of the study were presented in various ministerial meetings, and also came out in the national news, and interviews were done with several technical people to ask how the study has impacted the urban poor. So here's just a data to show that around 2,832 household members were involved in the study, and there were 1,155 are children. So you can see average age of child is 10 years old, so they are around adolescent age. There was also 18 to 19 years of adolescent involved, 3%, and 64% of the household had 1 or 2 children. You know, and knowing there is such a small staying space, you know, there are also families where they had 2 generations, and also families with 3 generations. So when you say 3 generations, that means grandparents, parents, and children are staying in such a small space, you know. So that's why I would like to highlight here. And in the well-being part of the study was whereby they interviewed 50 households, head of households, and all of them were women. Okay, the key findings from the families on the age study we see is there are 4 sections. Health. You can see, although health-wise, how health status is affected, especially dietary quality has dropped, you know, and also it's aggravated the child nutrition outcome. Medical access, although access to antenatal, postnatal care was not affected, but some 30% of them had difficulty having medical assistance because of not accessing to public health services, public hospitals or clinic, because transports are not available. And also the restrictions of movement is prevent them from having where children or adults taking another person to the clinic. Mental health, it's a concern, you know, whereby children's mental stress among mothers were a concern over children's well-being. As you can see, more than 60% of the family has children in their house. And how to say, an average age is 10, so there's adolescent age. And the prevalence of stress is very high among female-headed households. Support surveys, some of them do know about the support surveys, some of them do not know there are support surveys, and many of them in the study also say they really wanted parental guidance and support. Next slide, please. So as I said, I will focus on 3 components: nutrition, mental health, and then on education. So under the nutrition, we know how important is nutrition for children and adolescents who are growing, not only physically, also emotionally. You know, there are a lot of hormonal changes that's happening to them. So here you can see an average of head of household consumes more eggs during this COVID time. You know, during this you can see more of them take eggs. Why egg? This is the most economical protein. Rice and instant noodles. You know, instant noodle is a quick meal. It's also a very cheap meal, and less money spent on snacks and sweets and fruits. And those families who are earning less than 2,000, which is around 500 USD per month, tend to spend more on eggs and instant noodles and less on protein and rice. There was also, in part of the survey, there was also when they asked why you are not spending more on protein, on like fish and meat. They say it's very expensive, they can't afford it. And you can here also see a quote from the mother, you know, that she says, we need to be frugal. Normally we cook rice and we keep it for lunch and dinner. We have to eat less food. Just imagine her whole family have to eat less food, how much portion will be for children. They have to share and divide whatever they have. And okay, and this one, household poverty and food insecurity do have a long-term impact on children development, especially physical and mental. And children at this age, and adolescent, when they go to school, especially in their B40, they do get how to say school meals, free school meals. But when the school is closed during, especially most of the time duration of COVID, very rare. There are only certain period where the school was open, and then it has to be closed when, especially when there's COVID in the school or during the government lockdowns and movement control order. So these children have no access to the school meals. They have to share whatever meals at home with the family. Next slide, please. On mental health, there is also cases of depression, and especially among female-headed households. And roughly 1 in 2 parents believe their children's mental health state has been affected by the movement control order because they have to stay inside the house. They can't go out. They can't play. They can't socialize, which is all very important for their balanced well-being, growth. In the phase 4 of the study, about 1 in 4 parents stated that children have become addicted to internet, social media, and their smartphone because they have to continuously use all these gadgets for their lessons, and so it is also it's not only stress and fatigue, but it's also you get addicted, and 1 in 5 children have sleeping problem. Almost 2 in 3 parents have stated they needed parenting advice, because in the past, the children were going to school, have time in the school, and then they come back home, and then they spend time with the family. But now, during the COVID situation, they are at home 24 hours, so a lot of adjustment at the parent side, the caregiver side. There is also a lot of adjustment has to be done from the children's side, especially adolescent at the growing age, where they also need to, important, not only education, also social engagement. And the one thing I would like to highlight here is on the top is the from the UNICEF, where it says there was 266 cases of suicide, and 1 in 4 was committed by teenagers aged between 15 and 18. So it also shows that, I do not know if it is directly impacted by COVID, but during this March to October is a COVID time of 2020. And now we could see there is also a number of teenagers have committed suicide. And also the female-headed households, they are very concerned that they're not able to provide for the family, especially their children's future. Next slide, please. Okay, education-wise, only 8 in 10 children using online learning and 2 in 5 have insufficient equipment, especially children among female-headed households. Most of them use smartphone or take the smartphone from their mothers and fathers to use because they don't have access to gadgets, or they have very limited gadgets to share around. And then also there are children who, parents are unable to support the children in using the devices due to limited resources of time and knowledge. And also maybe their education and the children's education time is different. Okay, majority of the parents wants their children to return to school instead of attending online learning, because they find that in the PPR flats, there's not enough space to give the children this place to study, Next slide, please. Okay, so the impact of COVID on adolescents, as I said, beside the FOE study, there is also other statistic that shows that there is a sexual crimes is happening among children. There's around 1,721. There was also another study done by Childline Foundation, where adolescents are also saying that there is overwhelming responsibility and pressure from family, financial setbacks, lack of food, and also digital challenges, on online learning, and increased stress and irritability. Next slide, please. I think I'm in the last slide. So I just want to conclude that the COVID has an impact on everybody. I think everyone attending this session will say yes, it has impacted each of us in many ways, So and now we can see it also has impact on adolescents, especially the poor and vulnerable, whereby many of the access for which affects their nutrition level, their mental health level naturally, and also the education level. This presentation do have a limitation in data because the FOE study is not directly interviewed the adolescent, and I really strongly recommend that we need more information on adolescent and COVID to be collected so that there is more, that we can do a generation of evidence that contribute to the identification of appropriate response and policy-related decisions. Thank you so much.
Thank you, Jaya. And yes, it's quite kind of telling how some of the same themes are echoed, across the Lao presentation and the one in Malaysia, even though the contexts are quite different. I think some of the groups that are affected, the kinds of groups that are affected, and the programs that are needed, really kind of, you can see some similarities. People can now, we've done with the presentations. Thank you again to our speakers. I am going to ask you a couple of questions that I had kind of thought would be interesting to get your response. And in the meantime, for the audience, please post your questions in the question and answer box, and we'll get to those as soon as we can. So one of the first questions I'd like to ask actually for both the speakers, and maybe, we can just go in order, is, you really covered a lot of information and a lot of kind of various programs that were happening in your countries. It seems obviously that neither one agency or one unit or one, a person certainly can do this. So how do you successfully kind of engage and collaborate with the multiple stakeholders and organizations that are needed to work together to achieve national goals? So maybe we can start with you, Sitthiroth.
Yes, of course. Thanks for the question. It's very important question. Based on our experience, especially for during the COVID outbreak, my ministry, Ministry of Planning and Management, is a key coordinating agency. So that's why the government assigned some ministry to come up with the response policy. Especially to try to stop. I'm myself working with the economics affair and that. So that's why governments come up with the how we address with the situation, and at the same time, we also try to communicate. Also. We also the main agency who working with the international development, because Laos still very much depend on the development support. So that's why we set up a team with different ministry. Those more involved with the health issue, Ministry of Health, for economic affairs, and at the same time we also try to mappings the policy and try to encourage the development partner, to sort of allocate the funds, from their original plan, their plan to allocate to those who can respond to the COVID. At the same time, we mobilize a lot of funds, from public, from the private sector, especially for the vaccines, the purchasing of the vaccines. Because now we need to increase the coverage of this before we can open our country. I think that's the way that we try coordinate. Lucky that organized structure, the government organization structure, we have planning who can coordinate, who can also cooperate with the development partner, and also private sector can link each other. That we can achieve the national goal. Thank you.
Jaya, thank you for that. Lots of important points.
For us, I think in Malaysia, I like to give specifically one example. That's how we work as a multi-stakeholders collaboration. For example, on the comprehensive sexuality education in Malaysia, whereby UNFPA and UNICEF at the UN level, we are taking the lead. However, we are also working with the NGO called MKKM, which is focused on children and adolescents, and whereby there is engagements from CSOs. There are also participation from relevant ministries, the Ministry of Health, Ministry of Youth, Ministry of Education, and also the religious affair units have also involved, and also the people from universities, academics are people also involved. So this way, we are continuously having a lot of dialogue and discussions to see how we could really bring up issues of national to achieve the national goals. One of the issues that we are currently working on is on the child marriage plan of action, because Ministry of Women last year, they launched the strategic plan on child marriage. And currently, we as part of this CSE technical working group, we have come together on a regular basis to contribute to see how we can also participate and provide inputs on the national plan, which is also part of the government's shared interest. So I like to stop there. This is one of the experience I like to share.
Yeah, so both of you have brought out, very interesting kind of points and ways that the governments really at the very national high level are trying to work together. And, I think that's a lesson to be learned for many countries. But Jaya, I'll go back to something that you alluded to when you were doing your presentation, and also maybe again address it to both of you. How do we engage adolescents in this work? So, what you just now touched on was a little bit the high level national, agencies, of course, the private sector. But should we be giving, adolescents more of a voice or more of a platform to engage?
Yes, I think you want me to respond?
Yes, both of you, but yes, go ahead.
Yes, I think it's very important we give them a platform to say, because they should be part of the discussion table. It's not that we plan and we give it to them and say this is for you. They should be part of our discussion table, and decision-making process is very important. For example, in Malaysia, we have the Cafe Teen app, whereby UNFPA worked together with the National Family Development Board, which is also a government agency under the Ministry of Women, whereby we came up with a Cafe Teen app, whereby we do a lot of work related to sexuality and reproductive health, whereby discussions comes from the young people, and counseling and sharing sessions also come from their peer who are also from their same age range, but they also have professional counselors. So this is one example whereby it has been quite success, and recently we did an evaluation to find out how is it going. And in that evaluation also we included young people as part of the focus group discussions and their parents, and we also asked young people who are not engaged in this Cafe Teen app, why are you not engaged in it? So that we can really understand and see how we can further strengthen. So there are some gaps we have identified, and we like to further strengthen the Cafe Teen app. But this is one good example of bringing the young people as part of their growth, letting them get involved, so that even when we do policy decisions, even in future when we do programs, the inputs come from the young people, because they know what's best for them. We can look at it from a macro level, but they are in the ground, they are the ones experiencing it, so it should come from them.
Yeah, that's a great example, and yes, something that's really making sure that when we say stakeholders, that really means all stakeholders, including this very important demographic. I don't know if you have anything to share from Lao experience.
Yes, Amina. I think we have a similar program. Of course, it's very important to engage, the adolescent young people into decide into the response policy measure. I think in Laos, we have been working very closely with our development partner. Lucky that we have a lot of support from like organization like UNFPA, UNICEF, who have been provided the support for the young program, especially with the mass organization, the Lao Women Union, the Lao Youth Union, to develop the programs, develop the campaigns, to get people in terms of the, provide communication, the information to them, get them involved. I think in the program that the Lao government undertake with UNFPA, and also the mass organization, which is part of the you know, the UNFPA, the global, I think, campaigns, you know, me, my body, my planet, you know, that's why get all the young people, adolescents involved with the, you know, campaigns, contributing all the safe life, offline, online awareness, you know, about raising the campaign, the video campaigns, you know, risk communication, that kind of thing. Myself, you know, sometimes I follow the, you know, the online kind of radio, you know, the invite of the young people, adolescents, to share the experience, what they learn, what they know about COVID, what they know about their mental health problem. I think that's how we engage the adolescents.
Okay, great. I did have some more questions, but I'm aware of the time, so I want to take some of the questions that have come in from the audience. And actually, the first question ties in, Sitthiroth, with a lot with what you just mentioned. So the question is, do children and adolescents still access mental health services at health facilities in Laos, or they only receive counseling support through the hotlines?
My connection is not good. Can you repeat again? Amina?
So the question is there actually any access to mental health services at health facilities, meaning in person, or can they only receive the counseling service through hotlines? Yo, you just turned yourself on mute.
Sorry. So we have both. I think we have the counseling service at the health facility, especially in the main big main city, and also as I mentioned, we have the counseling service where the young people, adolescents can call and to consult the counselor. Yes, we have both.
Okay, great. So I hope that answers the question. And the same person also asked, does the Lao government provide any cash transfers for the people?
Yeah, it's very good question. This is something that I like to learn from Malaysians' experience too. I think we need to decide a program that really try to address the short-term impact, you know, and also linking to the sort of a long-term, a medium-term, you know, promoting all our social development indicator for adolescents, for young. Because we have the problem with the physical space, physical position. So I think at the short term, you know, as a researcher, it's very important, you know, to get people back to school, you know, to get people access to the service. I mean, and that kind of short term, especially in the rural area, the cash transfer program is very important. And development partners, you know, also recommend us to support, but at the same time, you know, we having the difficulty in terms of supporting that kind of program. But of course, now we are working with the development partner, some of the like World Bank, like ADB, like UN agency, you know, some of them decide the cash transfer program. Especially the World Bank program now are doing a cash transfer for nutrition outcome. I think that we have, but not big program. We have some part of that.
Well, so the third question is also about Laos. So you're on the hot seat. And this is 43% of maternal deaths are affecting these young, productive adolescents and women. And this number is quite acceptable. So you have, of course, apart from creating awareness and education programs, what else could the government do to intercept this sad and unfortunate happening? And does Lao culture have any impact on these poor people?
Sorry, the last part.
You know, what can you do? What are the programs that you can do to help the maternal deaths in the young adolescent women? And does Lao culture have any impact?
Oh yes, very much the culture. It's very impact, especially the high maternal death, especially for young people. It's in the rural area, in ethnic city groups. Of course, the past decade, the last decade, 2 decades, development partner together with the Lao government has provide a lot of funding, you know, develop the program that's really reach to the most vulnerable groups, especially in the remote area and the ethnic area, where the girl have less education. That's why they have forced into the early marriage, pregnancy. They have the problem with nutrition. I think that's we are trying to working at the moment. And the good things now, I think most of development partner, we try coordinate. We have a kind of target setting, the common target that everyone can sort of do a mapping. Who can support what. What's the government going to do? That kind of thing. That's try to. We are working toward how to address that kind of program, which is related to the poverty reduction program of the country. Thank you.
Okay, great. I'm looking at the time and we're kind of running out, but I do want to have one last question. And I just want to, one of our audience members has asked the question, has the addiction to internet social media been shown to be linked with anxiety or depression? And for this, I'll say, please log into our next webinar. So that's next Wednesday, where we're talking of technologies and the impact of digital space. And then I would go to our last question, which really says, how about the flip side? So we've talked about some of the negative aspects, obviously, of COVID-19, and those remain a lot. But what do you think? Is there something positive that you need to, you can take out of COVID-19, and maybe both of you can discuss on that, and then we'll wrap up after that.
When you say something positive, is it a personal positive that you take up from here, or is it from the adolescent perspective? Sorry, I just needed some.
Let's focus on that adolescents. What is there something positive from there? And of course, if you want to talk generally, so.
I think from adolescent positive wise, I think for those adolescents who are working, I don't have any evidence, but I'm just thinking through, looking at, I also have families with adolescents. So those who are working, part of the family where they're working parents, I think COVID is a time where they have more time with the family because parents are working from home. So adolescents who are also learning, doing online learning at home, maybe there are opportunity for them to have better relationship with their parents, or parents are monitoring them because parents are also working from home. So that's one thing I could look at. Also another thing is maybe less exposure to other violent issues and things like that, because they all are mostly at home and under the care of their parents and protected. So but it's but both but whatever the two information I shared, there is also the negative side of it, where it could lead to violence, it leads to abuse. So I stop here.
Okay, I think for me, I agree with you. I mean, side of COVID, get member of family together. That's why we build up the, our close connected to the family. I agree. But another thing that I like to add more on economics perspective, especially for the Lao case. I think it's a time for us to think about how we are going to increase our domestic production. Since the border closed, especially Laos is a small landlocked country, you depend very much on import products, even the daily products, that's why you import a lot from your neighbor. But then when the country locked down, you can see that the government, that's an opportunity for the government to promote domestic, products, domestic production, especially agriculture. You can see that the manufacturing, tourists, that kind of thing, it seemed to it's been affected. But from my the figure that I got, you can see the increasing trend of agriculture production. Based on people switch to domestic production. That's another positive things that we can see from Laos. Thank you.
Great, thank you so much. I think looking at the time, we are forced to wrap up. I'll just end by saying Thank you so much to the speakers and to the audience for being with us. And to the audience, I'll also say, please log into our next webinar, which will talk about the digital environment for teenagers and address maybe some of, the question that some of you had. And thank you to the UNFPA team. Thank you to the SDGHI team. It's been great talking with all of you and spending this hour together. And stay safe, everyone. Till next week. Bye-bye.